Kingdom for over 30 years in various capacities. Worked in the commercial sector, in retail. I've worked in the industrial sector, and I've also worked in the hospital sector of pharmacy. So that gives me a very good broad perspective of all the different aspects of pharmacy. Very well experienced, and I've dealt with people at various different levels of the profession. Now, looking at the experience I've had in the UAE with regards to the practice of pharmacy in the UAE, my assessment is very much that we've come a long way in the UAE in terms of pharmacy practice. There are obviously a lot of goods that have been done, but there's still an awful lot that still needs to be done. The sort of things that are of concern to me is the fact that I feel there's no consistency in the practice here. I mean, there are lots of rules and regulations which is to be commended, but however, there are varying degrees of practice, which unfortunately is not what I had expected. However, I feel there needs to be better enforcement of the regulations in terms of how we deal with patients here, in terms of ensuring that they get the best service. Medicines optimization is an area that I am particularly very keen to talk about, and that's going to be the main focus of my presentation at the safety conference, but I feel that is going to be very, very useful in the environment we're in. It's also great to see the insurance companies get involved because ultimately the insurance companies have a very big role to play as they are mainly the payers of healthcare, of the healthcare funds in the United Arab Emirates. So they will be very, very useful in the part they play in regards to pharmacy practice. Some of the challenges to an emerging pharmacy profession are quite varied as well. However, I want to focus on two main challenges I find since I've been here. One is the unfortunate situation of supplies. I must confess, it's been quite disappointing and quite challenging as well, because I feel in the UAE, with all the technology at our disposal here, supply of medicines is still a major issue. I know 85% of the medicines are imported, and therefore a lot of the suppliers have a very big role to play. There's a bit of disparity in terms of how you get medicines here. It seems the government sector doesn't inherently have the same problems that the private sector has as far as medicine supplies are concerned. So I think one way of getting around that would be for the suppliers to have a better way of forecasting, or have a better forecasting model that they use in terms of their net supply of medicines to the UAE, so that patients in the private sector are not at a loss. The second challenge that I wish to perhaps focus on is communication. I feel the level of communication between the pharmacists and some of the other healthcare providers, particularly the physicians, is not great. I'm not quite sure in terms of the curriculum in the UAE whether communication skills is one of the aspects that is taught in the curriculum, but I would strongly suggest that that is an area where, as pharmacists, we could do better. We're not always very proactive to the needs of the clinicians, and I also believe perhaps because of the perceived role of pharmacists as just primary suppliers and dispensers of medicines, some of the consultants themselves are not sometimes very receptive to some of the suggestions that pharmacists have. I think what I would propose in terms of how to deal with that is have, particularly in hospital settings, what we call a multidisciplinary team, where doctors, nurses, pharmacists, and all different healthcare providers are meeting together on a regular basis to discuss individual medication needs and treatment plans for patients. And in situations like that, where there's common and shared objectives, maybe the pharmacy skill can be more forthcoming to help the profession. New trends in pharmacy. I take you back to my home country where I've practiced, which is in the UK, in England in particular. Pharmacists are now prescribing. Of course, they have to take special courses to ensure that they're competent to prescribe. However, that's the step forward. Pharmacists can prescribe mainly for minor ailments. They are now linked to primary care setups, like in practices, surgeries, where they take the load off very busy doctors and are seeing substantial amount of patients, where they can consult, promote good healthcare, and prescribe. And I think that's a step forward. That perhaps is not something currently that we're anywhere close to in the UAE, but it's something to aspire to. And I also believe that by having that sort of scope for pharmacists and opening them up more to the general public starts to understand that pharmacists are not just glorified technicians or dispensers. They'll see us for what we really are, which are the experts as far as medication and drugs are concerned. In terms of future, pharmacy, I believe at this stage is at a crossroads. We're not very good at promoting ourselves. Patients don't understand what our role is. My proposal will be to perhaps think about having a separate body that takes care of pharmacist affairs. Like in the United Kingdom, for example, we have a separate body called the General Pharmacy Council, as well as the Royal Pharmaceutical Society. These two bodies regulate as well as help to promote the profession. Similarly, doctors have the GMC, which is the General Medical Council, as well as the other body, which is the British Medical Association. They do practically the same sort of thing that I just mentioned about pharmacy in terms of promoting the profession. And I believe until that happens, pharmacy will always be seen as, well, not a first-class profession, which it should be, because after all, we spend considerable amount of time honing our skills. 4 years in university and 1 year pre-registration, which is just 1 year below what doctors do in university, is, I mean, a fairly substantial amount of time. So, I mean, hopefully that would help to promote the profession. It will help to improve the communication skills if that's taught in pharmacy schools. It will enhance the professional standing with the public, and there'll be more respect from other healthcare professionals. Pay rates will increase, and the profession will be more attractive as a career to the wider selection becomes more rewarding. Another good thing would be most hospitals to adopt a system of having medicines information as part of their offering, because I've noticed whilst working in the UAE, it's very difficult to get any established environments where you can have proper medical information supplied to you. Safety conference, my presentation will be on medicines optimization, because I believe as pharmacists it is our key role to ensure the safety of our patients, and until our patients are actually taking the right medication for the right ailment, and ensuring that they're using it correctly, we will still struggle as a profession. It is key that our patients ensure that there is good medicines optimization, and I think it's also key for the healthcare profession in the UAE that people are using the right medicines for the right ailment and using it at the right time and at the right doses.